Hi, my name is Grace Burke, and I'd like to talk to you today about Morton Comprehensive Health Services, which is a nonprofit here in Tulsa. My presentation today is going to cover Morton and its mission and vision, its services and programs, the structure of the board, its staff, its revenue sources, and the nonprofit sector according to Solomon. I will have a separate video at the end describing the history of Morton, so if you would watch that as well, I would appreciate it. Thank you. So Morton is a 501c3 nonprofit corporation. It is a federally qualified health center, more commonly known as a community health center. It is Joint Commission accredited as a primary care medical home. It is a Tulsa Area United Way agency partner. It has 6 freestanding clinics as well as 2 embedded clinics, one in the Laura Desta Center and the other in Family and Children's Services. It is a national teaching health center, which is a very unique venue for medical students to practice in and learn. Most of them are usually in hospitals as interns and residents, but we have a program where they come through Morton and experience primary care in the community. Overall, Morton offers health services on a sliding scale to those folks who are low or no income and can't afford health insurance. And we want to make sure that everyone, rich or poor, gets health care. The mission of Morton is to provide health services, support, and information to all people regardless of their finances, culture, or lifestyle. The vision is that the patient is the center of all things healthcare, always, as it should be. Morton services and programs foster the community's overall wellness now and in the future, and this is achieved through relationships and collaboration with all of our community partners. I would like to take you on a tour of Morton. Unfortunately, we can't do it in person, so I've taken some photographs, and I want to tell you a little bit about what we provide and who provides the services. First of all, our primary service is primary and preventative health care. We have a pediatrics program, a women's health program, and family practice, and we have providers of all levels that provide care to people of all levels, of all ages. We are very proud of our children and women's health programs. We have furniture within our exam rooms to make it just a little bit more comfortable for our kids to come in. Seeing the doctor is usually not the best thing they do all day, but at least if we make it a little more fun, they're a little more comfortable. As you can see from the collage, we have a great women's health center. We have midwives, and from what I hear, we deliver about 20 babies a week. We have a full service pharmacy for patients who are enrolled at Morton. We have a full-time pharmacist, that's Terry, and the wonderful thing about our pharmacy is that the average med cost is $8, and that includes the brand names and the preferred drugs. And for those folks who cannot afford anything to pay for their meds, oftentimes they're free. We have an optometry department, a full service one, for eye exams and intervention, and we have eyewear, frames for kids and adults, as well as lenses, and a great optometrist, Dr. Kopp. We have a full-service dentistry suite in 3 of our locations. We also have, as you see on the picture on the right, we have a suite for pediatrics for young kids. They just painted, so the pictures are not back on the wall yet, but you can see that the chairs are a lot smaller and the equipment is more specialized. We have an audiology suite. One of the community partners in the area, the Scholl Clinic, has installed a soundproof booth in Morton, and we're now able to provide audiology screens and evaluations and speech screens. We have a full-service lab with a centrifuge and a lot of other equipment. Whatever we can't do in-house, we send out, and the results are back in 24 hours. We also have a radiology department with a full radiology suite, and we do a lot of mammography. Sorry, I have trouble saying that word. The wonderful thing about the mammography is that for a person who may not have insurance and have preventative services covered, we have a special program that will actually provide that for free. We have transportation. We have a lot of transportation. We have a full fleet of 14 buses that go all around town throughout Tulsa County and actually go up to our Bartlesville and Newata sites as well. I'll tell you a little bit more about a transportation program in a minute. We have a lot of services. We have a lot of other important services other than the primary health care. We have nutrition counseling. We have a full-time nutritionist. We have a WIC program, behavioral health, case management, of which I am a case manager. It's not all I do, but it's really fun connecting people with services in the community. We have legal aid with us 20 hours a week, and we provide health insurance enrollment for Medicare, Medicaid, and for the marketplace insurance. Just to name a few funding sources that helps in our community through Morton, there are way more than these, and it would be a really long video if I showed them all to you. So just for starters, we were talking about the pharmacy program, and so we are partners with the 340B drug pricing program, in which drug manufacturers provide outpatient drugs to Morton at significantly reduced prices, and sometimes if the medication is more inexpensive, it can be free. And again, for those folks who don't have insurance or can't pay for their medications, sometimes we can dispense it to them for free. But our average cost of a medication is about $8 a prescription. We have the Susan G. Komen Circle of Hope, which provides free women's health and breast exams to women who qualify. We have multiple funding sources for our homeless clinic, and when you view the history video, you'll learn a little bit about our homeless clinic. But we have one in Midtown, and it's been there since 1999, and the funding sources assure that the clinic will always be free for them. There is not a sliding scale for them. They get to go there for free. They also have the ability to utilize our transportation, and that transportation goes to 20 local social service agencies around town so that the homeless can start to see a light at the end of the tunnel as they try to set up services and access more services within the community. Sorry. We also have the Area Agency on Aging Transportation Grant, which is a free transportation grant for more than 600 seniors, and we take them to doctor's appointments, grocery stores, pharmacies, senior center, to the senior nutrition sites around town, and to many other areas. As far as our board of directors, we currently have 12 board of directors. As per federally qualified health center policy, at least 51% of the board members have to be registered patients, and that means that 7 of our current board members are actually registered as patients at Morton. All the board members donate their time to assist with our community events, national meetings, community health fairs. We register voters, and so those are the activities that they engage in. The board meetings are held monthly, and the board chair, Ed Thomas, has been serving for 7 years. And it would be totally remiss of me if I did not introduce you to John Silva, who is our amazing CEO. As for the structure of the staff, we have 3 functional divisions at Morton: the Admin and Finance Division, the Clinical Services Division, and the Community Advancement Division. Revenue sources. It's pretty amazing, but our highest revenue source is program revenue. But the reason that that is the case is because program revenue includes Medicaid, which is our primary payer source for the folks who come to Morton. And so the program revenue is about 47%. It also includes Medicare, private insurance payments, and fees from our pharmacy. Federal funding is about 22%, The state and local funding is about 11%, which is actually very, very low, and has been cut quite a lot in the last couple of years, as I'm sure it has in many other states. We're fighting now to stay alive because we serve so many folks that we don't get any compensation for, and the funding that we're really looking for is the state uncompensated care money. The pool has been cut recently and has been slashed drastically. Private grants and contracts include United Way, Zero Foundation, George Kaiser Foundation, those kind of contracts. Okay, as far as the nonprofit sector, according to Solomon, we are a public serving nonprofit. Obviously, we provide services, and those services are provided to the community. We also are part of the advocacy and problem identification part, and we draw attention to issues in our society, and we give a voice to the underrepresented communities. That's my video for today. Please don't forget to watch my history video so that you can learn a little bit more about Morton. Thank you.